just make sure everyone put their protest speeches on their phone these days. Alright. There we go. Alright, how's everyone doing today? So, I'm Brendan Williams, and I'm a hard of hearing individual, and I'm also chair of the Maine Statewide Council for Independent Living. So, thank you. One of the best. We got plenty of folks, and we got a couple we'll be hearing from shortly. But I just wanted to start off with a speech of my own. We are here about Medicaid and cuts and how we are against any cuts to Medicaid. I'm a constituent of Senator Collins, somebody with a disability. And we're here to urge Senator Collins to reject any legislation that would cut Medicaid or impose harmful work requirements. Republicans keep telling us that people with disabilities won't lose their coverage. But let's be clear, this is not how the bill works in practice. Even people who qualify for an exemption under the so-called work requirement will still have to prove it. That means submitting paperwork, meeting deadlines, and navigating confusing bureaucracy, often every single month, just to keep their health care. Apparently when a politician wants me to donate, that's easy to do, but trying to get health care is a little more difficult. And yet we don't know what kind of documents will be required. What will count as proof? Who will verify it? Will people need internet access, a printer, a reliable mail system? These are questions that have not been answered, and they matter. Because this bill won't just hurt people who don't want to work, it will hurt people who are already working. It will hurt people with disabilities who aren't receiving federal disability benefits. It will hurt Mainers who are caregiving for children, aging parents, or family members with disabilities, and who suddenly have to choose between keeping their Medicaid or taking care of their loved one. And let me be clear, no one with a disability should ever be forced to choose between caring for their family and keeping their health care. This isn't about encouraging work. This is about punishing people for being disabled or even poor. People will lose coverage not because they're ineligible, but because they missed a form, didn't understand the rules, or couldn't keep up with the red tape. And let's not ignore the harmful myth behind all this. That people, they say they're trying to cut waste, fraud, and abuse. Well, that people faking disability to game the system. The truth is there are far more people with disabilities who are hiding it and not telling anyone than people faking it. People stay silent out of fear of discrimination, being treated differently, or at work or in their community. Invisible disabilities are real, and this bill makes life harder for people who are already navigating enough. The truth is Maine population is aging rapidly. Baby boomers are entering their 70s and 80s, and with age comes a higher likelihood of disability. The demand for Medicaid services will only grow, not shrink. Cutting Medicaid now would devastate the very people who would need it most. Your constituents, our parents, our veterans, and yes, eventually all of us. If you live long enough, you will end up with some form of disability, whether through illness, injury, aging, or accident. Disability is a part of the human condition. It touches every family, every community, and every life. Senator Collins has expressed interest in supporting work requirements for Medicaid through several recent interviews. But here's what's most important to remember. Many people with disability already work. and many others want to, but we have faced massive barriers that are beyond their control in Maine. In Maine, public transportation is limited. Some job sites aren't ADA compliant. Discrimination can still be very real. Requiring Mainers with disability to prove they're worthy of health care adds red tape, stigma, and unnecessary risk of losing life-saving care. Instead of pushing people out of the system, we should be helping them live independently. Medicaid helps people stay in their home, go to school, work when possible, and live with dignity. Senator Collins, we are asking you, don't cut Medicaid, don't impose work requirements, and don't abandon the people of Maine. Stand with us, vote no. Thank you. All right, since all of you didn't come here to hear me all day, we're going to go to our first speaker, Cindy Lee. She is somebody with a disability and has a story to share and is a disability advocate. Come on up.
I can hold it, and then I'll give it to you. Good afternoon, everyone. Senator Collins. My name is Cindy Leach. I'm originally from Freiburg, Maine, but I relocated to Greater Portland 43 years ago to find accessible housing, which I did in elderly Section 8 housing. Right now, I'm proud to say I own my own home and I live in Westbrook. The purpose of my presentation today is specifically directed to you, Senator Collins. I am not speaking to you only as a person with a disability, but as a senior with a disability. That's not something I relished having reached. I never said I would grow old gracefully, and so far I've been true to my word. I am here to share my life story, explain the stress, and how critical Medicaid funding is in supporting home-based care programs. These cuts to Medicaid specifically propose restrictions on long-term services and supports, specifically provisions aimed to curb long-term care, nursing home care, and home and community-based services, which would impact people with disabilities and seniors. I was diagnosed with juvenile arthritis in 1967. I have survived because of Social Security, disability, Medicare, and Medicaid. Without these programs, I would not be here talking to you today. I have beat the odds. I rose above the assumptions, diagnoses, and predictions, and in several ways accomplished things in life I was told I could never do. I had to fight for an education because even after the Rehab Act of 1973 was signed into law, the regulations were not written until 4 years later. Therefore, enforcing the law was very difficult. And I lost my place. Oh, because the law was new and the regulations hadn't been finalized, that did not happen. I did not go to high school. My superintendent and the school district saw it fit to send me to a sheltered workshop for mentally handicapped adults. The law states specifically that when choosing alternate education, that it be appropriate. This was not appropriate. I continued to study, but it took 9 years for me to get my GED. Then I earned a 4-year college degree and ultimately became gainfully employed. I have worked for 40 years in social services. I have worked as a crisis intervention counselor. I have been a dispatcher at a local police department, and I have worked as an independent living specialist for an insurance company who provided counseling and information referral to their disability claimants. I also got married, bought a house, and have lived independently with the help of in-home caregivers or personal assistants. I need to know, Senator Collins, where you stand on Medicaid cuts and how it relates to personal care assistance for people with disabilities. I know you've said we have enormous debt and deficit, and we do need to evaluate programs. No doubt that we need to evaluate programs, but with these proposed level of cuts, you'll be throwing the baby out with the bathwater. The way this big, beautiful expletive bill is written, that's what's going to happen. If these cuts go through, mark my words, there will be casualties and suicide because some people will not survive. Senator Collins, I can't believe that you or members of your party really want that burden to fall on your shoulders nor to have blood on your hands. I refuse to believe that the entire Republican Party is that far removed from common decency and sensitivity for their constituents. Too many Republicans are more interested in following the party line than to represent the needs and concerns of their constituents. The disabled community is well aware of where Donald Trump stands when it comes to people with disabilities. His contempt is blatant, and he has not kept it a secret. I can cite examples, however, today is not the place. It's not the objective of the day. I understand that while you have not indicated your specifics about your decision not to support the big, beautiful bill package, you have agreed that Medicaid is crucial to seniors and people with disabilities. It concerns me greatly that the Medicaid cuts specifically threaten home-based care. These in-home care, personal care assistance programs allow me to live independently. If these cuts go through, I stand to lose everything. I mean everything. I will lose medical care and, most importantly to me, attendant care. You have said, and I quote, "When I disagree with the actions of the administration, I have not hesitated to intervene." Senator Collins, we need you to intervene. I would also like to address your Medicaid work requirements for able-bodied people who are capable of working and do not have obligations that keep them from participating in the workforce. My concerns are, who will determine who is able-bodied and who is disabled? Specifically, who will determine which people with disabilities are capable of working and what obligations keep them from participating? And this will require everyone to be redetermined for eligibility. For example, going through a vocational rehabilitation assessment. I am also concerned about the sections that talk about targeting people between the ages of 19 and 65. That would be required to work, attend educational programs or community service at least 80 hours per month. That basically translates to 20 hours a week. I, for one, could not do 20 hours a week with any of those options. If I could, I'd be doing it. I'll be 68 years old next month, so my age combined with my disability does not afford me the mobility or energy to do that. I do not think that this is fair nor reasonable. Yeah, thank you. Although the work requirement says complex medical conditions will be acknowledged, I think that term is too broad. I think it may include people who cannot fulfill those eligibility requirements. It's not a very good feeling to know that your mere existence is such a constant complaint and problem with conservative lawmakers and others who maintain such a negative and pessimistic attitude about value and the worthiness of people with disabilities. I have to ask, what do you propose I do when I lose everything? My husband is 70 years old. He has been helping care for me for over 40 years. He is unable to provide 24 hours, 7-day-a-week care. He's done his time. No one can work and do that amount of time. Nursing homes are absolutely not an option for me, but I know there are many others who will be forced into that option if they are not allowed to stay in their homes because of no care. Senator Collins, I'm asking you. No, I'm begging you, don't do this to me. Don't do that to us. Just because I need help dressing, using the bathroom, eating, and help around my house does not mean I'm not worthy. I am worthy. We are all worthy and deserve and respect a decent quality of life. I have thrived living with a quality of life thus far. To have it yanked out from under me right now would be devastating. If you vote to support these drastic Medicaid cuts, you are voting to end the quality of my life and in some situations, sadly, end the lives of many other seniors and people with disabilities. So again, I'm asking you to support me in maintaining a quality of life that can sustain me for at least a couple more years. Please vote against these Medicaid cuts that will jeopardize my independence, health, and well-being, and survival. Thank you.
Thank you so much. Well, just to say we're here for about urging Senator Collins to not make any cut to to Medicaid. And so we got a couple more speakers, so I think they'll be touching on the topic. Can I?
Would you mind just taking a cigarette outside of the area?
Can somebody go in and see if there's somebody that can come out? I'm gonna bring up our next speaker. We got Marie Ford. You're on next. Yeah. I just want to say quickly, we got people with vision impairment, and so I just want to say I got a blue sweater on, curly hair, and behind me are like technical equipment and some plants.
And I have brown hair. I'm wearing a white respirator, a red sweater, and blue jeans. And for folks who aren't accustomed to that norm, it's a wonderful way to introduce yourself in any group that you are a part of, because we make a lot of assumptions about who can and cannot see and hear, and it's just another way we can include. And frankly, we could all use those reminders, I think, right about now, especially when talking about this. My name is Marie Folatar, and from 2016 to 2022, I worked every day of the week, and I never took a vacation. And I loved every moment of it because I was working. It was amazing. I was making a difference in the world, and though I struggled to learn everything from how to organize a protest to how to write a press release, I was learning and adapting and building a life. I was in rooms and worlds you really can't imagine. I was there with people, and the very act of telling my story as we are now could have impact, which was not my experience as a person with a disability. My experience was, you better hide up that story and lock it up. You're not going to tell it. That's the world I grew up in. The shame around having disabilities and not being invited into polite society because of what might happen. But I was delivering, and I wasn't too messy or too anything. I was me and welcome. And it felt great. And I helped turn a Facebook post asking if people wanted to meet with Senator Collins and Senator King into an organization that at one time had me going full-time, and I had 3 other staffers working besides me, organizing hundreds of events, frankly, just like this, all around the state and in DC, working with veterans, attorneys, faith leaders, building a movement of Mainers. Not leading as I needed to on disability rights at times, but seeking to advance in the rooms that I could. But then in 2022, I got sick with COVID and a rare chronic cancer, and every day I could do less as I needed to take more care of myself, manage my medical care, fight to find doctors who could treat my condition or understand one of my diagnoses. If folks relate with that. And I felt every piece of my life drop. And I couldn't figure out how to pick it up or how to tell another person to. I was struggling to communicate. And eventually I was in the office of my palliative care physician assistant as failure to thrive, and describing my brain as having fallen out all over the floor. And I couldn't pick up the pieces. And as time continued, I couldn't eat and I couldn't drink. And I spent over a year begging for help as I wasted 130 pounds from provider to provider in this state. I could not work because I was mostly bedbound, but I was still as relentless as always. My focus was on my survival, and my drive was focused on getting myself the help I could get. I could not find a chronic care case manager who could manage me, or a doctor. I needed to do whatever I could to manage me. But what I can do every day and what I can give back to this world is directly related to the medical care I receive and my ability to have insurance. I need medicine to function. How many others need medicine to function? Woo! All right. So healthcare is a basic human right for us. We can't function without healthcare. So I just really want to move beyond this healthcare conversation, and I want to start having some real talk. So what are we talking about when we're talking about healthcare cuts? We're talking about body bags. We are talking about body bags. Literally. It's not drama, it's not political theater, it's not a statistic to turn your head from, but that is what is at stake. Lives, period. So I need to insert that in because we are fighting for our right to live. And I have sat before Senator Collins, as my friend said to her, but it is my life on the line. And she said, I know, but. And then voted for these tax cuts to begin with in 2017. So I know she can turn against our community, and I have been there when she has done the right thing and voted against 3 times to overturn the ACA. When I have treatment and medical providers, I can lead and give back to this world in a way that is truly extraordinary. And I do not say that from a place of ego, I say that from a place of having seen it and seen it fall. And the entire community saw what was Marie Folatar versus what is rebuilding. The belief that it is will or taking or othering is unbearable to have on our community. Our new OMB director made it abundantly clear during his confirmation that people need to be thrown off the benefit hammock, as he called it, especially after COVID, when we were all sick. That is the agenda. So we are fighting against an agenda that is designed to kill us. What he is saying is that people like me do not deserve to live. Because if you throw me off Medicaid, I die. How many others do? How many know someone else at home who will? But it's not just because of the insurance, is it? Because that is the cruelest fallacy of this all, is that we have individualized the discussion of health care to poor, people with disabilities, and seniors, rather than as the publicly funded payer for our hospitals, period. So the question is, do you want a hospital? Because when 50% of our hospitals' operating budgets is publicly funded health care, and a third nationwide of all of our hospitals' operating budgets right now, this past year, was Medicaid. We're talking about, do people want care in an emergency? Let alone when having a child, when we're dealing with labor units close. Let alone around an emergency for psychiatric care. So I resent more than anything that I am put into a marginalized place to fight for Medicaid when it's all of us. And the work that we need the people and the public to do is understand that it is not just a statement about our liberties being intertwined and our freedom. We are truly interdependent because we count on you to pay the bill to the hospital too. And that's going to keep your care around. So when that wealthy family goes to MDI, do they need that hospital? Yeah. But that's the conversation we're not having. And that's the conversation that we need to take it to. Take it off of us. Bring it to the people. Susan Collins is the chair of appropriations. She's on the help committee. You know the work of Doge? She actually chaired the committee that did government oversight. On top of that, before taking office, she led oversight of the insurance industry in Maine. This is one woman who really knows how this will impact us. Do we really need to be speaking here? Because I'm tired of being the one speaking and not knowing what the hell she stands for. Give me more than a soundbite. What is she fighting for in this? Because that's what we need to know. Okay, you're against some work requirements. But what does that mean? You're against some Medicaid cuts, but what does that mean? Because we are worried. I have an energy deficit disorder. And I'm high energy, so it's really tough to balance. But I have to make choices around digestion and my body's ability to cool itself for energy. And maybe a form doesn't seem like a big deal, but when doing that form could literally flatten me for 2 days, I can't do that form, and then I'll lose my Medicaid. And there are lots of people like me who have to deal with that. So we need people to talk to us about what is going on and what the plans are. Because these stakes are too high, and every budget season we talk about budget cuts and body bags, but we try to make it sound nice with hospital closings and work requirements, when we need real talk about what the priorities of the people electing us are, and if our lives really matter. Because we can do beautiful things. Sometimes we just need a little assistance. And how is that different than anyone else? It's not. We've just been taught that it is different. Thank you.
Thank you for those powerful words.
Hold on 1 second, Brett.
Okay. We got one last speaker. We got Daniela from the Boston Independent Living Center. We worked with them and they come up along with another folks today. Alright.
Good afternoon. Thank you for being here today. We are here because we all want the Medicare not to be touched. Because this is the service that works. This is the service that gives us equality life. We be able to wake up every day and have a quality life and have a daily living. I'm Danielle Dikina. I am in Mass Health Medicare, Medicaid, I'm sorry. My children also are in Mass Health Medicaid. And these are the services that works for us. My son has a disability himself. And he also has Medicaid. And the services work for him. My parents, who's a senior, is also on Medicaid. And getting the quality life they appreciate, and they're able to stay home and have a quality life.
You say you're
And we don't have to worry about
Indians.
somebody go to work if we know what
Mackenzie.
to do. Like I said, we are here today because these services is what we get. This is the services that give us a quality life. And as you know, they keep on giving us applications to complete in order for disabled or not. And we all know that I'm just being here. I'm not going to get my side of it. Explain our disability. Why should we all have to go bed at night and worry about if we're going to have health care or how we're going to get our medication? Health care is important. Now, they're saying that they're only touching a little, they're only cutting a little, is what they say. They're just doing a little cut. But let me tell you, What little cut seems to you seems big to other people. That little cut could be something big that helps me throughout the day to have a daily living. So, I'm here today on behalf of myself, on behalf of my son, on behalf of my parents, on behalf of all of my consumers, and begging Senator Collins to please, please do not touch Medicaid. Thank you.
We got one last speaker. Do you want to introduce? Yeah.
This is Elle, who's our new neighbor, 17 years old. I'll let you speak for yourself.
So, my family all uses Medicare. Or Medicaid, yeah. Why do they call it Maine Care? It's state. Why not? Medicaid. My family is all on Medicaid. My meds are completely covered by Medicaid.